Good evening, dear viewers, and welcome to another episode of Health Link, brought to you in the studios of QTV by myself, your host, Dr. Shamila Jah, and my co-host, Dr. Masarendin Njai. We will be again talking about COVID-19. Dear viewers, as you're all aware, globally, we have now about 11 million confirmed cases of COVID-19 and more than 500,000 deaths registered worldwide. In the African region, the cases and the number of deaths also is increasing. And I'm sure you must have heard that the global leaders, health leaders are saying, we are yet to see the worst of this pandemic. So it is really a big concern to all of us. So what we are going to do today, this program, we are going to go back to basics. We are going to go back to our first episode, if you remember, on COVID-19, we talked about how do we prevent this infection. That is where we are going to go back, because as a population, as a country, we all should be taking precautions, particularly at this time when, as you have noticed, the cases in our country as well is increasing. It is not time for us to relax. All countries at the onset, what they do, just like also the Gambia has done, the government helps the population by bringing on a lockdown or measures to make sure people learn about the virus. Once people learn about the virus, then the government starts easing out the restrictions. However, because government cannot follow each and every one of us, the authorities cannot follow each one of us, it is hoped that people will have learned how to prevent themselves, how to protect themselves, so that when it opens up, when they go out, they know how to take the necessary precautions. Unfortunately, we have seen not only in the Gambia but other countries, when easing of measures takes place, it's as if there is no more COVID-19 or this virus doesn't exist. It's like we have not applied what we learned while we were inside our homes when we now come out. So it is so important for us to reinforce these messages. Please, 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 for all those viewers watching us today, this is a very important episode. We'll be opening the lines shortly, and we have a very important guest here with us who is going to help us remember these preventive measures and to go into other preventive measures as far as COVID-19 is concerned. The other disturbing thing I'll mention here, and I'm sure my colleague will translate it to my other viewers, is to our viewers in Mandinka and Wolof, is that at the beginning of this outbreak, we saw deaths happening in the elderly, in the age groups that are above, the age of 60 and so on. Now we are seeing the epidemic evolving, and we are registering deaths even in younger age groups. So it means that now we cannot say that just because we are young, we're not going to get this, we're not going to suffer or die from this virus. So please let us take this thing very seriously. So I'm sorry if we are going to start this program like this, but really I think it's time that we, as health providers, this is all we can do, is to really support you, provide you with the knowledge that you need to equip yourself. So over to my colleague, Dr. Njai.
Baraka bake Dr. Jah na bari lamu lal bal be kontonna bal bismillah na program wala men kada health linkti men kanale QTV jang comme nga fo nyamen do wato wati nal kana pour nale kacha nyin sasale ka fo me COVID-19 membe keden dunia kono say za fo men nako al balalen say be bi men don ne dunia jube men siata mo million tang anin kilinte wala nyin sasa soto and mo men fata siata mo wul keme lulting fenti dunia kono sayente ni nata jube Gambia fanang be damen sayenteng bayira ko molbe la fakane luwolu na banko kanjang woto kamala dunia mole menke wala nyinti ko dunia londilal be sitale ka foko nyin sa da nyanta futal damen hanisa adasatale woto akamda fenne menti wote me alon ko wolbe ke kan sayen ba mba je ka hani Gambia jang nun ton ka foko mo mu wanna so sayen ba fala fo mo taworo nimfeng woto kada fende te me alon ko anyanta kala mo be de on ko let wakamala ni ajube masakunda semen keno wale ko mole ko anga lockdown ke wale ba fala state of emergency mole sida suwol kono mole tenkun ngana tablal korose wol be ketale pour ngaje control ngam fankanta men fantankala nyin sasala nyaadi wa wakamala bi nalbe kacala men na wala nyinti ka jube men fantankala nyin sasa ba ni ajube sa nyi manke fenti me alon ko fa kolem nun to kabala data follow ken kam même fo le nyinti kebal men sala sanjita woroti aka wolel batandi bak men yalon ko sasa sifa do suru aka wolel batandi bak ba say ne dunya kono jube men ka fa baajla ko e be mu dinni ngolel akam da ko say tabulo nyi yele matale oto kammalantol men yalon ko mu fanninkel to mu dinni ngolti manya nasila ngam bulula nyoka nga foko nyimbe ka dinni ngol fa ngam bulula nyoka wo nyama men diata nyembo kala o kata fennete me yalon ko be nyantan hakilo to to baba kele pour ka jube même fan tankala nyame nyin ko nim botan dan lockdown ron dal sate wol ko non dafta munel kala wolen kam fan tanka me nyi sasa me fan bol la nyim bala nyaadi oto nim mol botata soge tate mo keno oto wala nyindi ko yala fan nasio na fatala oto kamala bi nga lunta mbaso dal jamme yalon ko nalbe kacala pour ka jube même fan tankala nyin sasa la nyame ba wolen kuti me yalon ko akumayata ka foko aman solo say ngamla ngam kodi wala ba ko kanjal ala barka bake suñ mbokki déglukat yi ñu ngi la bismillah suñ programme bi te Health Link bu dee jógee QTV altine bu nekk comme ni ñu ko waxee lu ñu ko daan defee rek dinañ continuer di waxtaan ak yéen mbiri feebar boo xam ne ñu ngi ko ooyee COVID-19 soo leen ko bàyyee xel léegi fu ñu nekk nii soo xoolee tey àdduna bi yëpp lu ëppa ba 11 million people ñoo ko am te lu ëppa si more than 500,000 nit ñoo dee si COVID-19 bi si kaw loolu ñëpp xam nañ ne léegi fu ñu nekk nii lii nekkul waxi caaxaan parce que aduna bi WHO ak yeneen organisation wax nañ ne fu ñu nekk ni lu ñu war a gis si feebar bi ñëwaangut te dafa mel ni loolu moo nekk di xew parce que soo xoolee Gambia maybe 2-3 weeks ago ñu ngi wax ay 40-30 léegi ñu ngi wax ba 60 something cases boo xam ne am nañ ko so si kaw loolu war nañoo bàyyi xel trop naka la ñu aaree suñ boppa si feebar bi soo ko xoolee woon bu mu commencé woon ñëpp a ngi doon wax ne ñu daan gën a sonal mooy mag yi ñu daan gën a dee ñaaka seen bakkan mooy mag yi ñoo xam ne ëpp nañ 60 years and above waaye léegi ñu ngi gis ne xale yi seen boppa sax mu ngi leen a yóbbaale te loolu nekk na loo xam ne fu ñu nekk ne ñëpp war nañ koo bàyyi xel waruñ koo caaxaane moo tax tey ñu ngi am suñu gan bu mag fii pour waxtaan ak yéen naka la ñoo defee pour aar suñu boppa si feebar bi jërë nañ jëf.
Thank you so much, Dr. Njie. So today in the studios we have here someone that is very important in this COVID-19 response. She is Dr. Fatoumata Diba. She is in the infection prevention and control pillar, which is one of the very important pillars, as you know, in the COVID-19 response. Thank you so much for joining us, Dr. Diba. You're welcome to the program. So just like I was saying in the beginning of the program here, the preventive measures for COVID-19, because we want our viewers to be reminded. When we started, we were always saying that. Can you please remind us about the preventive measures that we can use to prevent ourselves from getting COVID-19?
Good evening, viewers, and thank you very much, Dr. Aja and Dr. Njie, for having me over. Like you rightly mentioned, prevention is always the best way to help curb diseases. So the preventive measures, everyone knows about them, and we've been singing them over and over. So it's just a reminder to our viewers. It's the basic things: hand washing, making sure we wash our hands all the time when we touch surfaces, doorknobs, tables, and then when we touch these things, we avoid touching our eyes and our nose and our eye and our mouths. So those are the basic things. Hand washing, we can never overemphasize that. And wearing of face mask. When you wear the face mask, it's not as if you are like protecting yourself from getting the infection, but rather you are protecting everyone else around you. So if everyone makes it a habit to wear the face mask, then we can safely say that we are all protecting each other. We are like each other's keeper. So we'll encourage our viewers and every other person to make sure that they continue washing their hands with you don't need any expensive things to wash your hands, just regular soap and water. If you can't get that, you use alcohol-based hand sanitizers. Avoid touching your eyes, your nose and your mouth, and then we wear the face mask. Those are the basic things. And surfaces can vary, and then it's not just the surfaces can be from rubber to paper to doorknobs, everywhere you go. So when we should be conscious and make it a part of us. Wherever we go, when we come back, we wash our hands. And this shouldn't be just the adults. We should also make sure our children, we put this habit of hand washing into them as well.
Thank you so much. And of course, the other measure that that you've also been talking about it is the social distancing or the physical distancing, which we are currently even doing right now here in this place. And I know you do it where you are when you have a meeting. This seat, you cannot sit on it because of social distancing. Yes. Thank you so much for reminding us, Dr. Diba. Just like she rightly said, hand washing, which she can even do by closing her eyes. I've seen her doing it so automatically. It's like part of her. Not only will protect you against COVID-19, but also other infectious diseases. Dr. Njai, before you translate this, you've seen people out in the public together in groups and all of that. And the other message I think also that maybe we should inform people is avoid going to crowded places.
Exactly.
Where what she talked about, like you can't avoid being next to somebody or to practice social distancing. So to try and avoid it. What do you think about from what you are seeing currently happening in the public? Is it something that people should be mindful of?
I think it's at this moment it's a very worrying situation in the Gambia. Because people are not taking this COVID seriously. If you look at it from all perspectives, you go to the market, you go to the other place, sport fields, you go to video clubs. People are still doing the normal thing that they're doing. So I think they still believe that if you go to the provinces, they tell you Kombo Sasa. That means this disease of the Kombos. So you realize that people don't really take it seriously. But I think from what is happening all these days, the number of cases that we are having, the mortalities that are coming up, I think is something that people have to be very serious about it.
Exactly.
It's something that we are very, very concerned from the health perspective. It's something we are very worried, and I think people have to be serious about it.
Yes. Before you translate the basic messages we talked about, there's something that I found very useful, which I'm practicing today. When you are a right-handed person, you use your right hand all the time, and that is the hand you always use for everything.
Yes.
The tendency to you touch your face with the hand or scratch yourself or whatever with that hand is very high.
Yes.
So advising people to use their non-dominant hand. For example, I use my left hand when I'm opening a door, or when I'm flushing a toilet, for example, I use my left hand. So a left hand, the likelihood of you touching yourself is very low. So I think maybe that is another way, in addition, of course, they still have to do the hand washing, but using the non-dominant hand maybe is another. I found it very useful anyway.
Okay.
Yeah.
I think that's very important as well.
Yes.
Yo ba namba di la moyla comme men kachaka walem na luntamba men keda Dr. Fatmata Dibati fanambe Ministry of Health le bundala men yalon ko le marta min sasala tankaro Kenya la be men kachaka mbi walen kam wol hakilo bulande sa sanyin men fan tankano la nyaadle bawo nganyim fole ni tala television ba jela jele newspaper to don kilo la tala misisano le don kilo la men fan tankala nyame so amanke fendi me yalon ko kukutale moti nyimbanko kan bare ba jela ko ngamla mol man e ma ko muta seriously wala man amuta akela hajiti so wota kamala wala na mol diam yamari men na wala nyinte men fan tankala no nyaadi le wala nyinte kam buluku e be buluku nyanko ni tala la to sasa keso se trano jele te dula ma sasa tre bulo bala ye nyama wala nunguma wala dama ye sasa nyisoto so be ke be fan tankala wala ni tala dawol dala ni ye buluku fay sene buluku nyin amanjari orra sawel amanjari pan la amanjari fen boy ta bla ba fala kon ton man pano so man sa kunare man pano amasula pan tasal ken so be bulu su kono yalon ni safno sa yalon ni ye buluku fay sene bot nan sato kono ton ye buluku ay sene ibe finterlo ye buluku ita dawdara ndi ye buluku jani be dunaje ni mo so e sanitizer sale kamen sa wa fiten ye bulu fitala wato wat wodo kata fende me alon ko amon ko le felem ni nga dindingol fanan nga kata nge e karandi wala bawo on kata su kono dindingol sa be ta feale be fintle mina e bike bulul ku wol kata fende te me alon ko nyantam fan tankala wala bakal ako ni wo bata je fanan nga jamfanyo wala wala nyinti ko memem fokan do ni man haji sodot lamento si su kono nata misal fe etata ebita marché to sen duga keno telephone duga keno wasaba yake yalla ndi su kono man jareta marché to luwolu ako to ni tala je fanan nga membe fero men kala wala nga face mask ko nyindum wala ke ni ngoni da mabo ako ni odun amanke fendi me alon ko comme ete ke fan tanka ye mo bodol fan tanka bawo maybe kuran men bolete bala ibala ko abe tanka la wala so to nata be face mask ko dun ndaka fokono nin danga du tiya dum hani te toto le ti soda akana te ma nyaata futan wonde ma woto wakala fende me alon ko abe mbere tankala ko ta fende me alon ko wala nyindi bulu ko wato wate nga face mask ko du wato wate ani nga jam fa nyona be jam fa la nyona nyaadi wala nga meta fa la nyamen donc sa nyi man sin soto abakata du lado ida yeta kamana moya wala moya na feya e be fan tankala wala nyaadi le wala ni mol kana suti anyo ni mol man suti anyo le eta di no le o ko ta fende me alon ko nyanta ka ko muta bake thank you.
Okay, so dear viewers, we'll be opening our lines. The number will be appearing very shortly, 5050505. Please call us. We are discussing about COVID-19. Dr. Riba, I also wanted to ask you about the environmental surface, like like disinfecting surfaces in the homes and at the workplaces, doorknobs. And all of that. What solution can we use to disinfect?
The solution that can be used for disinfecting surfaces is just household bleach that has 5% of chlorine in it.
Okay.
Yes, it can be easily available. I'm not doing an advertisement for any company also, but the one that is readily available is the Madar one.
Okay.
Yes, people can. Yes.
Okay.
Yes, any other one that has 5% bleach, you just use it and clean surfaces.
Okay.
Yes. For the hands or the human body, use 0.05% of the same bleach.
Of the same.
Yes, we can be easily prepared at home.
Okay.
Yes.
Okay. Okay. That's very important information. Doorknobs, which people use all the time, is something that she's talked about, that you have to disinfect. Commonly used surfaces, whether it's in the workplace or in the house, for example, places where people always sit there. These are areas that we need to disinfect, and you can do that, she said, with bleach and water solution.
Comme lu ñu waxtaan rek mooy naka la ñoo mën a aar suñu boppa si feebar bi COVID-19.
Dr. Njie, we actually have a
call is
caller.
coming in.
Yes. Hello, caller.
Hello.
Yes,
Hello.
Hello, naa def.
jaama rek.
Jaama rek maa ngi si jaama. Hello, maa ngi lay.
Nu ngi laa dégg.
waaw man la Ibrahima Sané.
Ok.
dama bëgg a contribuer ci programme bi.
waaw
ndax mën naa switch ci Mandinka because loolu laa jëlaat li fi bu baax.
Yes, no problem. Yes, bismillah, sa fono.
Dr. Njie alla programme o beteta a ñiñata.
Abaraka.
nte ñun banko ntolle dentala ntol be ñinda ñoom maako nan. Because atol la molti momi yalan ko be jikin atol la andungal ko kumal le fonni mi yalan ko be maako el.
Ale.
Ni ani ma fo mo fo il faut wala kende ya.
Ale.
Inda katala yo tanka. Ni social distancing ama betia tale ko ngake. Ko nga measures que mi yalan ko be tol maako la. Aben banko di ngon maako. Because ko raw do bi je nya sambere di mbay kon. Atoro ñing awar baaki.
Ale.
Saya kurau ni ama dan belakang tak wajabil.
Wajabil ya.
Ni dunia aku nak jual ni kan ni jual juga kurau ni jaga wajabil. So nyanta lo kala amma ko ke banko la, banko di ngolan dama wa nyamba ko.
Ale.
Bon na program do kana sur mi yana ko ni tinda ni motol ko non. Program ban bi je mi yana ko ibuka driver li mbata ni ba. Because ni driver man pare kam banko mon ma ko. Because ni aje ni ndam mo do ko ka mo do fo de to le kan e to le kan mo pul na man ke di COVID-19 fo.
Exactly.
Ka do bi jakata de bala.
Ale.
Aka sound. Like example in tobacco process no chief. Bo ko mo do bi to le ka to le ka bi ke de mo fo ko ba. Which is very bad.
Yeah.
O fana bi and also na airport fana. Nga programme do so ni yana ko kana be kata ko la bati
ale
min satina banko mol be tankala nyaadi le
ale
do ko la wol ka jela sa ni mol lu tawon nata be mesos kala nyaadi gani be dindi mo hal banko mol kan
ale
be tankalo kala nyaadi le dindi la moto ko nyaadi le be control la nyaadi ta wol be onle anno be dala bakel albakata kan alla kada ko warta so the pasaro kala mi ala kontrol kala be lola ko kaji ko nimba ko tanka an ñu courant ni kana wade ni ala sorta o ñong o be siala
aka
ala baraka mba be ko ton
ya baraka bake la kolo la ngamle min fa kumata bake nim banko be tingo ye mira ko ete mira nyamen do ngamlam be da hala nyim problème ko non ba yakku kilim faten docteur Diba be wala fokan wala nyim mol men ka sutia moto kono nyim face mask ko men ka ana fabe kala wala fangoti ni be dunna moto kono do narta mo be moto masko du moto kono do isaje ko tanko nyime la fa bala jele o do be nyando kala kulit me alon ko nga ko ken na hajote
wakam fana coming ya fo nyamen ka face mask nyol dung ani nini mol benta ka fo kono coming ka nyu hakil bula nini mobe totola ya fa ya buloka akabuka anonon ko ka dato fana be ma ko ro kala coming nyin membota kumandiro la ta ya fo nyamen amanke hana manke covid-19 fongoti sasa dola misalo di le tuberculosis wo mun tonya leti so comme mol se o fana ke la jikoti ni be dawda ni be toto la ka fo kono yeka nonon kungol ke da to be ma ko ro kala ba
and bringing the windows down if bring the windows
aninka ni be palantir ni be motol fana ko ni kari parantero yele saje fonyo kare dum fana ha o fana kuma ya tabake o fana be mol ma ko
hello caller. Okay, I think we've lost the caller. Yeah, so that's an important question about the car that he talked about. So maybe Dr. Njai, you can translate what you were trying to do before we had the caller.
Comme ni ñu doon waxtaan rek mooy naka la ñu aaree suñu boppa loolu la ñu waxtaanee tey comme ni ñu waxee rek docteur Diba moo fi nekk pour waxtaan ak yéen tey lu ñu doon wax rek mooy naka la ñu aaree suñu boppa mooy raxas suñu loxo bi loolu nekk la loo xam ne wax nañ ko ba soona léegi fu ñu nekk nii. musiciens yi woy nañ ko télévision yi génne nañ ko radio yi wax nañ ko foo dem rek di nga ko gis te loolu nekkul ne loo xam ne lu ees la ñu ngi ko wax rek te dinañ continuer di ko waxaat rek mooy ne ñu raxas suñu loxo nag jafewut parce que ñeneen ñu ngi complain ñun amuñ paan bi ñun amuñ li déedéet loo soxla rek ndox ak saabu sa kër so loolu suñ ko defee rek di nga gis ne ñu bari nañ mën a aar suñu boppa si feebar bi te su passé loolu tamit lu ñoo wax rek mooy face mask su nekkee ne yaa ngi génn di dem si mbooloo foo xam ne nit dañ faa bëri nga jël masque parce que yow soo jëlee masque di nga aar sa boppa nga aar ñeneen ñi tamit so you have a caller.
Yes, we have a caller. Hello caller. Hello.
Kayra dron.
Hello sumol.
E bebi jam.
Korda.
Talante.
Yo. Allah kaja kumayata bakele.
Abaraka.
Dr. Njai, you can tell her to just speak on the phone and not listen to the TV.
Isa jam fatale la domandi mbang. Hello.
Ay mo bele jakari ya bake bala en kacha. Ay mo jama kunni la mo jama so hakilo.
Ale.
Kada ni ma ke kudo kama isa ke ile bala jato la kenne ya kama.
Ale to nyal.
Mo jama bi je man ta lalim ko ni nanu ko do na man futele buka akala ngolo.
Ale.
Okay.
All right, I think
it's gone off here. Okay. So,
I think ebe men foka nga kumayata bakele wala mobe ya faham ko nyin sasam fenete me ala sototale anu nyin seneyan don kamem faten dron o mum fangol la kuwelti me ala ko sulata la ni aju ben na hadama yal kono na dinol kono seneyamu fenete me ala ko kubetole ni na raju en kanyum bulko membe fo moye seneyalam dron ba mbe dinno jele wato don sa fala suko nale dinno seneyal al bloku safno ni jola nale fengo dol ko suko nale al bloku safno ni o be pour kan tan han nyin kono bay kuno men ka dinno mu da kan tan kabela so ko bulko on fenede me alon ko ngamla mota fala moy ko mambete antakela o mi fan sun tankala ngolti ni la dimbal be.
Okay, thank you so much, Dr. Njai. So, Dr. Diba, the other thing I was going to ask you is, we know we've been seeing also, I'm sure our viewers have been seeing also in the TV, when a person passes away because of COVID-19, the way they bury them is not normally the normal way of doing it, and also they put them in a black, bag. We've seen it on TV. What is the significance of that?
Like you rightly
Oh, I'm so
mentioned.
sorry, Dr. Diba. We have another caller. We'll take this caller and we'll come back. Hello, caller.
Hello, Assalamualaikum.
Walaikum salam.
Ada yang?
Beja rek.
Hello, Assalamualaikum.
Walaikum salam.
Allah program be dia limba ke.
Baraka.
Baraka.
Kumaya ta ba ke.
Baraka.
Ay ka mi fo den ay ka tunya le fo den ngam fa kan tandi nyum kurang ora nyami. Ngana dimba fanan kan tandi ka dum de afele ni finde dai ta dula dum ni na ye bulo ku sa kuno dai sen ya se. Bajama bije dolu imanyum kurang mu da hani penne tantu nyanta ga amfan tankan ni to nya kurang mu futa na jamano kono bari. Ben fango tankan ni nyami pura kana futa ja. Nyanta ga wole ga la programo ese den ka jubela. Adia ga ba ga mo kunin dile.
Baraka bake.
Nyara
Baraka bake. Bare yemen fotron akuma ta bake. Bare memang fola drong sasa ni manche ko amam futa jan sa ben konole be sate ko konole mo mala men na sai nzalom be salo nyama be ngam to nyama sai sai den ka foko abe banko kanjan so mem kumata role be mem fantangala nyame baraka bak.
Okay. Coming back to your
Yes, Dr. Diba.
question about the dead bodies.
Yes.
The dead bodies can also be a source of infection.
Okay.
Yes, when it comes to some highly infectious diseases, and
okay.
like Ebola and COVID-19 is one of them.
Okay.
So it is better to play safe around dead bodies, making sure that when you are washing the dead body, you are in appropriate protective gear, like gloves, like aprons to protect yourself. And all this is geared towards making sure that the disease is not further spread. And some countries have burial teams, and in the Gambia too we have like the Gambia Red Cross Society. Volunteers are trained across the length and breadth of the country. They'll be the ones to be conducting these burials. It's not as if they are going to take away the dead bodies from the families.
Yes.
No, it is not like that. Whatever they are doing, they discuss with the families, they discuss with the religious leaders. So the only thing is the family members wouldn't be allowed to like have a lot of contact with the dead bodies, because if they have a lot of contact without protecting themselves, that can also be a source of infection. Yes, but it is not preventing any like to say you are not going to pray for them, you are not going to mourn. No. It's not like that. It's all geared towards preventing the population from getting the infection from the dead body.
Getting infected, Thank you so much for clearing that. Because, you know, when I saw that, I was thinking, is it possible for the other things to happen, like the religious rites, the other cultural rites? So thankfully, all those things can be done. But of course, this is to protect the relatives especially. Thank you so much. I think this is a very important message. We'll come back to this particular point later in more details and also maybe translate it for our viewers. But we'll take a short break. So dear viewers, we'll be back again. So keep your questions and we'll be back soon. Thank you. So dear viewers, welcome back. Just before we went on the break, you heard Dr. Diba. I was asking her about what happens when a person who is infected with COVID-19 passes away, and she was explaining that even after passing away, a person that has been infected with COVID-19 can transmit the virus to his or her relatives and the loved ones, and it can spread. So in order to avoid the spreading, she was telling us that there are special teams that will come and help the relatives. They will not take over the burial at all. Everything the way it will be done in both the Muslim and Christianity or any other religious tradition will take place the way it's supposed to be. But these teams will be there to guide, to make sure that the infection does not spread to other people. So I will pass this over, hand over to my colleague so that he can translate also. And then the lines are open as well, dear viewers, so please free to ask. Oh, we have a caller already. Hello, caller. Hello.
Hello.
Yes.
Hello.
Hello.
Yeah,
Hello, we can hear you, sir.
I remember Kanabang.
Anke moya.
Albe programme men kanten akumbaya tabake.
Okay, baraka.
Baraka.
Abe molu nafa kanne bake.
Baraka.
Bari nkenga miralo men soto jeto. Nyin ko be kafu kan nyamenna. Nyantale nga kata purunsa abute jannate bentolu butela.
Ale.
Ni tata sere kunna marse ko ne kijo ke farale. Membe kering.
Ale.
Hello.
Mboli be kering ne yalon ko ka ko nyon kumonte tonya.
Ale.
Aka kuya tabak. So nte kola.
Ale.
Kurang. Afindi ka to men place ki la sere lo kamenke. Afindi ka danga to ali kali jilu ko. Pour ay ko ni manke ndali mo. Na mata bank le ka dali ko ani sem ko di malemu. Na te ay ci sa de o fampo.
Ale.
Ko ni ma ko bole.
I think we lost the network.
Yeah, ngamna mela ko kumata bake yemen fo na faso do bakele. Comme ya fa nyamen drong fenne me alon ka be kirine gamen ngamnon to le mamuta kukumati ba yemen fanita marso ko no tonyala. Yemen fanam foten ni ajube ninka kibarol la moy wato wati luwolu ministre of health ka kibarol bolde ka fo kesol men sorte bota muntole. Obe kirine me alon ko luwola ka fole. Jamaji me ka moje ka kenna lalle men ya so ja nyimba ko kan jama. Men ya soto jay manta dawdar ne man siya bake bal men ya so jama mi kanale ni nate ye mute samba ko ananta ye na soto so sainten aje ko mol ka soto me alon ko man tam han jandinda o do kada fenne de me alon ko ade mo warta bakele mo nyande hakilu to to bake.
So Dr. Njie, you can continue with the translation.
Suñ bokki déglu kat yi comme niñ ko waxee tey suñ gan bu mag bi ñu ngi waxtaan ak moom si naka la ñoo aaree suñ boppa waaye laaj nañ ko tamit ne comme gis nañ ne am na ñoo xam ne yeneen dëkkay si àdduna bi ñu ngi gis si télévision ak newspaper yi nit yi suñ deyee ñan ñoo leen dee suulu waaye da nga gis ne lu dee xew mooy daf dee am team boo xam ne ñooy dimbale famille bi nekkul ne dañ dee jël niw bi si yéen de waaye dañ leen naa dimbale pour parce que xam nañ ne niw bi si boppam mun ngaa jël feebar bi foofu moo tax ñu leen dee dimbale nekkul ne dañ koo jël seen loxo ne doo leen mën a julli doo leen ko mën a sanga déedéet dañ leen naa dimbale pour sanga ko waaye suñ ko sanga pour naka ngeen a aaree seen boppa si foofu waaw si taami sanga bi nga gis ne ñu dimbale la solal la bagage yoo xam ne mun nga koo sol pour aar sa boppa si loolu te ñoon tamit dañ laa dimbale pour suñ ko sangee ba pare naka lañ ko toppatoo ba fuñ ko war a yóbbu c'est ñooñu dañ laa dimbale foofu waaye nekkul ne yow doo mën a def sa julli bi nekkul ne doo mën a toog kii moon ko ak yooyu noonu so yooyu yëpp si xam ne lu bokk have a call.
Yeah. Sorry, we have a caller. Hello.
Hello.
Yes, hello. Kaila drone.
Fatala.
Tala watananda.
Alla programu kumaya tabaki.
Yes, baraka bake.
Kale mbare ngento da fenyi kala ku kirenda.
Aha.
Ayanta gambe no ayanta mako elade.
Ade.
Ata hedo kulala. Wasinte ajira ku gambe no manyi kula mutafet. Jama. Mama da so fenet. Ibu kala fani he obekeri.
Ade.
Muso ne lu obekeri be donna. Dundi nyokono. Ha, o manta nyabo de. Man nyabo handa mande.
Ade.
Ayanta la kamo sensitize kende ka fon. Heti e finti kamo sensitize. Aja telefon para al ni he obekeri ka dum mo ko ne kamo bay.
Ade.
Gambia first time bidding a case screenshot. What are the most letter than signed by 60 something? Anu Gambia and Aliani, I need to say from prevent the book I came. Because near Bukula on the dato, there's not equal a book we book a song. The Kaja from Kumu what you found. Ha. So, Honey, I call that so long. Because what I've done to a Yamutan is someone. What the Bali, not your Mantano. Because how did they record that as one those na you conquer? ka jele ko maybe mo jawoti so ne jiolo le ko dala ni ko e buloku e ke so ne buloku la so ni ta de buloku la do ke to nye da fa wala ne makso je ba do ke to nye sai ti ga ta ma ko la mon tel ay man tankara okay ala baraka
abaraka bake la kol kumata bake comme ya fanyame health nyanta ma ko la bari nga fanyame nyin sasa kilo tuwawal kaf may multifactorial wala mojamal dabi je mbelen kew helte do ko soto jele mole do ko soto je man sakunda security lim fangol na do kula lopitan do kula hel do kula la do ko mendi wala nyinti kal jara nal sasat ato fanana do ko mendi wala ke fan tanka e kana nyin sasa soto so mba tanka la nyaadi le wala nyinti ko mo be fan jam fan nga même fa ali o moy ni na radio hanima sakunda e kato kele e ko mole ko state of emergency ye nambal le ke kul na nyanda ke nambal sa ita dawda musol tala futu sitol la molbe kulil wulin la molbe kul be kay sa ko mol fana man ko nyimuta fenti me yalon ko fen kumale anu ngalo nata fa kunda man tafu man sakunda be mol findina kiditiol findina kan ana ko dam be ma ko sa ni ngamo ko kiditiol be sa de ko ne ka mol fa e be mo jeta findila nyin sasa fana molti kel wala me yalon ko mbakaje nyala abe mol fa kana diata nyame so kamala be ngalon ko sa mol fa be nyanta ngam fan tankal hande man sakunda ma fa mola li da haka kafunyuma al nganda ha kulli wulinol ni maño bitol la folo ngawtu ye folo ba sasa da menta be wajabi kan ne bankoka. So I think you can talk about that one in Mandinka, the burial one.
Yes, maybe you can say.
Yo janding Dr. Njai be janding nyin call be dunanang mbe mon fokan no wala nyinti ko coming Dr. Njai nyinin karo ka kaya je banku dolto nimmo banta ten komi ka bula bagu fingo konote kata ibuka so ila moliama bari komi wo be niaje aka tankandiro ibe tankandiro dorone la pour nyin sasa akana wajabi dawoda bari Gambia jang timol be kerine Red Cross molu ni mo fata e kiskisiro ke ko corona virus nyine afa e ka jele Red Cross mol kanale ning abadi ngol yesi e kacha pour be suturaro kala nyame wo suturaro kono amanke koy kela fure wo mute bullede ware be bari le la fude masalolla wara ada kudol hani e ka men fodoro wore nyinti ko ni be fure wo kula wara ni be malala ibe ima ko le be fantan kandila nya message kana kuranke so nyin soto wo kono ha wo burial team nyolu yebe karandile be janyen ni banko karo bela saning mo banta coronavirus nyina e ka wolle ko mandina yena ini mbadi ngol ya kacha muslima len wo christian le wo mo me yalon ko ana fansum adol len ibe bulale yela ada ko be ke bari ko min ibe sutiyala e fura wo nyinna nyame e ka wole tala wo be mo nyineti doron pour kam mol tankandi sala wo doron ne aha mo be mo wo doron neti silandu ni wo mol nata ka ini mbadi ngol ka kacha pour ka foy ko nata nyinela ali nge mako en kara mutafi ni muso men fanal labanta kol kelata kuma bale fo wole ning ibe fantankandi kam mol be jelele la wara fen do ko ma do biye atebe bakawle na ako lundola tata no marse oto brikama aka musol jibe e ba fole mo nyodo ko muna la sasa be tembe jumal de ba yote ke ba jele kan bari wo man fem foy wo jele tal dorate tata ko e almalo ne men be kere ndoro bari
we have another caller. We'll continue. Hello caller.
Alaikum salam. Abaraka.
Ya, ala program mo nga assist sa kanya because yung adem yung dala marketing mo la de marot. Because yung masa ko yung to wala nila. Yo because bol de jari marketing pura yung dona ko niya lo madami kong kan. Bare ko kene nang panandige mumbo ko ni because niya di de jang ikapo na nan ka so kana Senegal lom dina bisao FIFA wonde kaso ko kamala ina nyanta maka kunda enda de maro kala wala ne ma ko dola yeta kinna ino tatani ala de kana siani banku kanya odo mo mandi manya dan na kabu kami ko puranda banku kanya abijale to nyapo abijale bari ngakar ke sanjel dan pantal kan ne mo ko na masa kana inde ma wala ma ko ndam ba sala ba
baraka bake ngamela kol kumata bakele comme ya fa nyame wo fantanko man sabe mako la fana même fam mako la ni la badi ngom be Senegal wala même be Gina ko comme ne jube la fa hani batu folo de sa salbe kedin sa folo ay si abe damento ba mbe ngalon ko ni nata ni sa sa nata badi le mon la woto ni tra mon même be Senegal wala Senegal même be gambe to gambe to be da halal ba me da fala ko sa sa nyum ka tamasi ngona ni mana fe wala moyta kam woto be se nyuma ko wala pour même fantanka la nyame wala ni bali men kamina fa ko hani ite tuje folo fanyi sasa bam folo abaraka bak.
You want to complete that what you were saying, or you're okay with it?
No, it's just
You're
about
fine.
emphasizing and making it a habit, because usually people will want to make fun of you. They'll be like, you are being overprotective, or they'll want to call you names. But the whole idea should be, whatever they say, let them just say it. Just stay safe, prevent yourself, protect yourself.
Exactly.
Yes,
I had the same conversation today about 2 hours ago. I had this exact same conversation, because people are calling someone, you are just too paranoid, you're too scared, you are dangaragal and all of that. But at the end of the day, you know, if you are doing it for yourself, and you should remain focused.
Exactly.
Hello, caller.
Hello.
Yes, hello.
Yeah, hello.
Yes, hello.
Yes, please. We can hear you.
Hello.
Yes, we can hear you.
Okay, Nayanef.
Yeah, Marek.
Okay, seen liggéey bi rafet na lool, seen programme bi like.
Jërëjëf.
Okay, man lu ma bëgg a contribute mooy. Like si hospital yi, like the Kanifing hospital bu nekk Serekunda.
Waaw.
Xam nga dañ fa taxawal like washing machine bi nii pour ñuy raxas suñu loxo yi.
Waaw.
But this issue is it's very unhealthy. Xam nga nit yi suñu raxasee seen loxo yi, like ndox bi maybe someone is not even attending to it. It's very unhealthy. It's like even the block boo xam ne dañ ko taxawal ñu teg fa pan bi is so very not healthy. At the end of the day, we are trying to get rid of the COVID-19, right?
Yes, sister. I think we lost her. But she was making an important point that if you're using something to wash your hand, it shouldn't be a means of also getting an infection. I think that's what she was trying to say. So that, you know, whatever we are putting out there, the water should be clean, and there should be the right materials for them, and the place should be neat as well. Yes, we agree with you, sister.
And I think we can channel to the hospital.
We will channel it to the right authorities. Thank you so much for that. So, Dr. Diba, the issue of the bodies, there's something also which I remembered regarding a corpse. This is for Ebola as well, and for also COVID-19. When a person dies, the virus in that person's body is at the highest level.
Yes.
Because it multiplied to that extent and overcame so the person is actually full of the virus because the virus has managed to kill the person. So the body is highly infectious, both for Ebola as well as for COVID-19, and other infectious diseases are also there. So I think what you were talking about, we are happy that there are people that can help to take care of bodies for us. We have another caller. Hello, caller. Oh, we lost that caller. But maybe this may be a message also you want to reinforce the reason why people are doing something differently for these bodies is because of this nature of the viruses.
Waaw comme li ñu doon waxtaan rek mooy affaire yi comme su demee ba nit gaañu si feebar bi mooy ñu nga am team boo xam ne mooy Red Cross ñoo dee jël pour suul bi waaye nekkul ne dañ dee jël sa niw bi comme ni ñu ko waxee rek dañoo waxtaan ak yow dimbale la naka nga mënee aar sa bopp parce que xam nañ ne ku dem ba gaañu si feebar bi mooy ne jàngoro bi dafa bari si yaramam bi te si kaw loolu mun naa yomba pour joxe keneen so moo tax dañuy ñëw pour waxtaan ak yow pour dimbale la aar sa boppa waaye nekkul ne doo ko mën a jullee nekkul ne doo mën a def sa yeneen aada yi mun ngaa def loolu waaye pour ñëw jegeñ koo def yeneen loolu lañ ñëw dimbale gars yi pour parce que xam nañ ne ku dee moom dee na already mënuñ ci dara waaye pour ñun tamit suñ bopp suñ naka la ñoo aaree suñ boppa si loolu mu war a nekk suñ liggéey moo tax gars yi am burial team bi pour ñu dimbale leen waxtaan ak yéen naka ngeen a aaree seen bopp.
Okay, jërëjëf Dr. Jah. Yes, we have a caller. Hello, caller.
Hello, sister Nadia.
Jàmm rek.
Hi, school.
Yes.
Alhamdulillah.
Dama bëggoon a bokk ci programme bi nii.
Yeah, you are welcome.
Nee naa wa dafa important trop.
Waaw.
lu am na ne feebar ci dëkk bi moom. So man lu ma gis mooy lu ñu mën a aral suñu boppa. Comme smoke in public bi nii. Boo so da ngaa tu nga sànni ko so sax buy dem noonu. so saat boobu kenn mënu daa wax ne fii la ma am si doomi aadama
waaw
so yow boo ko nekkee ni mën nga koo bàyyi comme garage yi place yi grand place yi so boo amee feebar bi boo tuyee ni nga saat bu koy dem noonu so dafa wala mën naa wala ñeneen ñoo xamante amuñ feebar bi so man su ma gis-gis mooy dañu waroon a stop smoking in public bi
there is already a law on that okay yes
boobu la amoon pour wax si programme bi jërëjëf
ok jërëjëf sa call bi I think loo wax ni dafa am solo trop first lu ñu wax ne tux moom baaxul in first place te Gambie am nañ loi boo xam ne aar nañ fa léegi fu ñu nekk nii pour tux si public bi loolu mu ngi fa waaye comme ni nga ko waxee rek ni nga ko daan waxee rek loi yaa ngi bëri waaye nit yi nekkuñ di ko toppa parce que li ñu wax ne socialisme nguur gi wax na ko health wax na ko kenn faalewuñ ko so public smoking bi tam there's a law about it already waaye Gambie ni faalewuñ ko so loolu amul waxtaan foofu daal mooy ne smoking si boppam moo baaxul sakatuma smoke si public loolu moom fa naa loo wax dafa am solo trop.
And then also the relationship between smoking and COVID-19. The smokers, when they have COVID-19, they can have the severe forms of COVID-19. Maybe that's also another thing you can explain to him as well. Since he's calling in a COVID-19 program.
Waaw comme na ko waxee ni comme ni nga ko waxee rek smoking tux moom baaxul te am nañ ne ñoo xam ne dañ jee tux trop su ñu amee Covid bi dafa gën a garaaw so su kaw la ñoo xam ne ñu ngi tux nañ bàyyi seen xel trop ñu make sure ñu prevent seen boppa si Covid bi jërëjëf.
So Dr. Diba, so if there is a helpline to call as well for people to access this burial team you're talking about? Or is it the same 1025?
Yes, it's the same 1025. There is no specific line just for the burial teams. No. It is organized in such a way that when a death happens and then they will call 1025, the teams will come and collect the samples. If the results come out positive, that is the time the burial teams will come have a discussion with the family, and then after the discussions with the family, they will go ahead and do the burial.
Okay. We have another caller. Hello, caller.
Hello, good evening. How are you?
Good evening.
Fine, thank you.
Good. You are on a very important program. Among the most important ones.
Thank you, sir.
Thank you.
I have a little contribution. It's good to sensitize people about COVID-19, but I'm on the doctor's point of government restriction on some of the issues. To my own seeing and my understanding is the government who broke the rules of COVID-19. This is why Gambians could not respect it anymore. Because we have a selective justice on it. The government, the president or the government cannot impose a state of emergency when his own parties are campaigning openly on politics. And you want a Muslim not to be doing his naming ceremony or a Christian not to be doing his marriage ceremony. It's going to be difficult. The government still needs to do more effort. That is to stop selective justice. Justice for you, for all. That is my contribution. Thank you very much.
Thank you very much. I think your contribution is very, very important. Just like we said, preventing ourselves. So if somebody is calling you for a political rally and you don't want to get COVID, tell the person I'm not coming. So I think this is very, very important for all of us to prevent ourselves. So if somebody calls me to go for a political rally where I'm trying to be preventing myself from COVID, I will say I'm not coming. I think that is something that's very important. Thank you.
Okay, so just like he talked about the health part of it is in our hands as individuals for us to take care. So Dr. Diba, we don't have much time, but I would want you to leave our viewers with a parting message. What will be your message to them? Something for them to remember.
Yes. I cannot overemphasize hand washing.
Hand washing.
Yes, it's one thing I think is very important. Let's just do it. Wash all the time. You know, all the surfaces.
She's
we
doing
can't
all the steps already. She's showing
I think yes. When we do it, it becomes a part of us. And you can do this with water and soap, and then hand sanitizer. And another thing. Let's please make it a habit of wearing the face mask when we are going in public. If we must go, that is, if we must go, let us please wear our face mask.
Especially where there is no social distancing like now that we are doing. Okay, Dr. Njai, we don't have much time.
Bari la mwela la kome programu fele watu mansia koteke. Mem fokan drong wakukili ngombe murra wale kang wale nyinti mem fantan kala nyame. Dr. Dibaya fale neko mem kumayata beti wale ndon na bulukuo. wato wati nga tambulo kula ana man kole afenna ila tasalo be bul so kono ani si jek je ani safuno o damma kanyantale ko safna ko ngama man dam dala stanna mamela hani badu bun ko be fola wal so ko da fenete me anon ko be nyanta kala na hajolti safna kun kilin ya sa yalla ndel tasalo fandi jole yalla ni so kono ye bloku wato wati bita dami mbal nimbar la mbal tentula suñ bokki deglu kat yi fuñ nekk ni programme mu ngay jessi waye luñ leen bëgg wax rek moy raxas loxo bi mo gëna important fuñ nekk ni te lolu pour def ko nekkul lo xamne dafa jëfé lo soxla rek moy ndox rek ak saabu te xamna job ku naay sa amal na ñoo mëna jënd saabu pour tek ko jëlé ñëf.
Okay, so dear viewers, we have come to the end of the program. So prevention is better than cure, and let's stick to all the preventive measures. Thank you so much. I would like to extend our thanks to the crew. Thank you so much. Until next time. Bye.